Good morning. My name is Corina Herrera Loera, Public Information Officer for Santa Clara County, and we will be taking our masks just during the segment so that we can have our translators translate and you can understand us better. We are 6 feet apart from our guest today, but before I introduce our guest, I want to remind everybody that we continue to be on tier orange, and some of you may have heard last night or yesterday that the state changed their order for counties who are in the orange tier to allow attendance at professional sporting events at 20% capacity. However, here in the County of Santa Clara, we will not be changing its order, and we will continue to prohibit attendance at professional sporting events. And the reasons for this is that 20% capacity of any one of our county large stadiums or arenas amounts to at least 10,000 spectators in these stands. And even if people are staying in their seats and socially distancing, they're still sharing bathrooms, exits, entrances, arriving to games around the same time and leaving at the same time, which can spread the virus to others easily. And with a transmission rate of 2 to 4% currently in our county, this means that one person can infect hundreds in a single sporting event, followed by continued spread of the virus to loved ones when they go back home. And also it means that here in Santa Clara, we absolutely cannot take any risks. You know, as you all know, we've been doing great. We are slowly opening schools, businesses, able to eat inside, and so we don't want to risk any of the work that we've already done. And so not while schools are still struggling to reopen, while businesses are still also struggling to reopen, and outdoor gatherings are still restricted to 3 households. So remember that we've worked so hard to get to where we are at. We've made sacrifices to get us here, and we can't lose this progress now. We can't put any more lives in danger. So that is the reason why we are not opening any of our professional sporting events here in the County of Santa Clara. Now, I would like to introduce our guest today, Indira Fonseca. Thank you, Indira, for returning to our show. You provide us with a lot of good information, so we want to make sure that we are up to date. Indira is our manager for the Joint Information Center on COVID-19 here in our Emergency Operations Center. So we have a lot of questions for you. Thank you. And let's start with our first one. Who should be tested for COVID-19?
Thank you for having me. But absolutely, everyone is welcome to test for COVID-19. Absolutely. They're welcome to visit any of our test sites, and information is available on secfreetest.org. With that being said, a person, so I'm going to go a little bit more in depth as to individuals that should be tested, should visit, and guidance for our frontline workers as well. So in addition, a person that has been exposed to a person who has been tested positive for COVID-19 should be tested. If they were within 6 feet of an infected person for at least 15 minutes or more at any time, 2 days before the infected person had symptoms or tested positive should definitely be tested. People who have been exposed include people who had had 15 minutes of continuous contact or intermittent contact as well, should be tested, as well as people with short-term interactions with the infected individual should be tested. Additionally, while face coverings reduce the likelihood of COVID-19 transmission, they have no impact on determining whether someone has been exposed to a person who tested positive for COVID-19. So we really want to make sure that individuals that should be getting tested are accessing our websites and maximize. We have a big testing capacity, so we definitely welcome them to visit our website and schedule a test, or feel free to walk into one of our sites, the ones that are walk-in friendly.
Thank you. And thank you for, reiterating the close contact, what that means. Like you said, 15 minutes at any time or closer within 6 feet. Because what does that mean, right? I know there's a lot of times that some of us are experiencing symptoms and we test positive, and we know but there's a lot of people that we don't know that have it, right?
That's right. And then there's also several scenarios that we've encountered at our call centers, our business call centers specifically, employers that have received calls from their staff saying, they just simply don't feel well, but they don't have a confirmed positive case. It is good guidance for that individual to stay home and access testing as well. We do have, there's several medical conditions that staff or individuals in the public have in general. So it is good guidance to just make sure that you are tested, public and also our frontline workers as well. We have to, the testing is definitely one of our tools to ensure our safety and the safety of our community.
Thank you. And so is it safe to go there? Or is the line, will it be long? Or how will people get tested? Is it safe to be there? Like, I've heard people say, I might get scared that I might even get it there. Is it safe to be there?
Absolutely. That's definitely one of the questions that we've received as well. I do want to ensure that Santa Clara County is doing everything to make sure that everyone that is accessing our sites feels safe. We are using, we are social distancing, ensuring that we also have appointments so that we do not have clusters of individuals that are trying to be tested. So we do have scheduling appointments. It's very important to show up at the time that your appointment is scheduled. Also, we do enforce face coverings at our site. So we definitely are ensuring that the site is safe, our healthcare workers providing the tests are safe, and also our community that are visiting our sites are feeling safe as well.
Great. And I also know that we have drive-through testing as well, right? So thank you for that information. Now, how often should a person be tested?
Yeah, so frontline workers and individuals are in high-risk positions such as grocery clerks, it could be our law enforcement, it could be fire. We do encourage them to be tested at least once a month, but no more than every 2 weeks, which is something that we also do as well here in-house, as you know. Also, COVID-19, it's very important to know that COVID-19 status does not affect employment status. If employees and employers would like additional guidance in regards to or information just related to COVID-19 at the workplace, feel free to contact our business call center and also our Office of Labor Standards Enforcement.
Thank you. Now, I know you mentioned that there were some cases, some scenarios that you've come across. Is there any scenarios that you can share with our community?
Absolutely. So there's different methods that an individual can be contract COVID-19. One of the transmission that begins at work or in social gatherings and then is introduced to the home. So meaning if you have a teenager that may not have the education or they may go to a gathering, come back and definitely expose grandparents, especially now we are seeing multiple families in a single household, so it's very important to ensure that we care for ourselves and hold ourselves responsible for our safety and for also the safety of our families. We also have households where they have more than one frontline worker, and that's something that, in my, personally, me and my husband, we are frontline workers, and we make sure that we do everything within our power to keep not just ourselves safe, but also our children and any in our family members. But yeah, most definitely, we want to make sure that. Also, something to note: once an individual is identified as a close contact, either by the contact tracer or just in general by the employer, we want to ensure that your personal health information is protected. So that information will not be shared to individuals of the public. We do have regulations that will protect your personal health information.
Mm-hmm. Thank you. And I know, even with myself, right, I trust my family and I love my mom and my brothers and my sister. And I'm like, well, they can't have, COVID. I'm just going to, sometimes I don't want to think that they might be carriers or even that I might be a carrier, right, to them or my nieces or nephews. And so I think we lower our guard easily and like, oh, well, it's my family, it's my mom. But we really have to be careful, not, whether it's them, it could be vice versa, right? It could be you transmitting it. So I know sometimes we lower our guard and we're like, well, it's just family and it's just us.
Absolutely.
But we need to be safe.
Yeah, and now that we're seeing that we're advancing to, now that we are in the orange tier and, hopefully in the near future we'll be in the yellow tier, We want to make sure that the holidays are coming, right? And this is just an opportunity for us to demonstrate our love through other avenues, keeping our loved ones safe. The holidays are coming, so we want to ensure that we could have Zoom invitations, have a Friendsgiving via Zoom. So let's get creative with that and be able to share our holidays, hopefully in the our future holidays with our loved ones in person. But for this year, at least, to make sure that we're taking all the precautionary measures. Also, utilizing our tools, the tools that we have right now, face covering, social distancing, our online avenues, Zoom, FaceTime. Let's utilize those to make sure that again, we can celebrate the future birthdays, our holidays, any special events, to make sure that we are able to advance and create a safer environment for us to hopefully be able to go back to hugging and contact. But for now, definitely using and abiding by our current directives and guidelines to make sure that that's something in the near future.
Thank you. So you heard it. Test every 2 weeks if you're an essential worker, and if not, once a month. We encourage folks to test with their service providers, their medical service providers. So if you have Kaiser, whoever you go to, and you've been in close contact, you are an essential worker, go to your medical provider. And as you've also heard, we have several sites that the county has throughout the County of Santa Clara that you can also get tested. And so we have a video that we'd like to show because I've also heard I went in the beginning and it hurt so much, I will never get tested again.
That's right.
And so I just wanted to show what our testing looks like now. And we have one of our coworkers who let us record her, Jessica
Rocha, one of our staff here. She's
staff.
great, and she was very kind to allow us to use her.
So here we
footage.
go. So you see, hand sanitizing. Everybody keeps their PPE on. Very friendly staff. All the staff that I've gotten, tested by are awesome and amazing and make you feel very comfortable. There's some information that they need to take down to ensure that our information, again, like Indira mentioned, is kept safe and sent to the lab with the correct specimen.
And you may also recognize some of the staff since they are often the ones in the sites as well. So great staff, great customer service.
Yes, absolutely. And so they do have, clean materials for each person. And this swab, and our videographer will head over to the other side. And it's just a swab, and it doesn't go in maybe a centimeter, if you could see that. Not painful at all. So he swabs one side and then swabs the other side. Very soft, not intrusive at all. And there it is. And she's saying that it doesn't hurt, it's not painful, and it's very easy and fast. So
And do
there
your
you
part,
go.
Stay apart.
Yes. So we just wanted to show the process of what it looks like to get tested. It's very easy. As you saw, she was fine, no tears, and so I just want to remind our community that it's safe to get tested, it's easy, and it does not hurt. And Indira, anything else you would like to add before we close up today?
I would like to, on behalf of Santa Clara County, the staff here, just thank you for your continued efforts to ensure that we are all doing our part and holding ourselves accountable to minimize transmission of COVID-19 and utilizing the tools that I mentioned. And we do have resources here available for our public, our employers, our employees that need support or just would like additional guidance. Feel free to contact us.
Thank you so much again for coming and sharing that information with our community. And all who tuned in, please continue to keep yourself safe, healthy. As Indira mentioned, wash your hands regularly, wear your face masks, keep 6 feet social distance from one another, And I know the cold weather is coming and we want to take our families indoors and we want to gather with folks indoors, but just remember we've sacrificed already a lot. We've taken our county to tier orange. We have one tier to go, yellow, and then eventually to get out of this pandemic. So let's not forget all the progress we've made. I also know, we have a lot of cultural events like Indira mentioned, a lot of
Halloween.
Halloween's coming up, that's right.
Thanksgiving.
All of those things. Be creative, plan ahead. Plan ahead for you and your family to stay safe. What is that going to look like? Making sure that we keep all these things in mind to get out of this pandemic. And our county is doing great. We got to keep pushing forward. Thank you all for tuning in again today. And remember, we will be again here on Friday at 10 a.m. To provide more information. Thank you.
Thank you.